Hey guys, SWEN physical therapist with YADAYADA. And in this video, I'll be sharing with you exercises for mechanical low back pain. More specifically, extension-based exercises. Exercises that are meant to help somebody with a extension directional preference. Now, if these terms sound a little foreign to you, you probably haven't watched my other video yet, and you're going to want to link to the video here. If you've already watched that video, and you've decided that you're a flexion responder, yeah, this is also not the video for you, and you're going to want to link to that video here. Now, if you've watched the video and decided that, yeah, back bending activities, extension-based movements, meaning bending backwards, are helpful for you, then this is the video for you. So now that you've decided that you're an extension responder, let's get into these exercises. But before we do that, there's a few things that we need to quickly review. The first thing is, while you're performing the exercises, you should notice that your pain is lessening and that it's centralizing. Also, you should notice that your range of motion and function are improving as you perform these exercises day to day. And the last thing you're going to want to watch for is, again, centralization and peripheralization. Now, being able to read those symptoms of peripheralization and centralization are super important and will guide your treatment. Again, centralization is positive and peripheralization is negative, and we want to stop those exercises and seek out another treatment if that is occurring. The other thing that we need to talk about too is that if you have acute or severe low back pain, you may not be able to do all the exercises immediately. You may have to start with the first two exercises and then progress to the last two as you begin to feel better and move better. Okay guys, Annalise agreed to help demonstrate the exercises for us, and so let's get to it. Okay, the first exercise is lying face down. This is used mainly with acute pain, but can be helpful for those who have had severe pain for a while. Start by lying on your stomach. Place your arms to your side. Breathe deeply for a few breaths and relax. Hold this position for 2 to 3 minutes. Do this 6 to 8 times a day. Start each session of the exercise this way. So if you're going to do more exercises, this is how you want to start. It should be noted that if you are unable to achieve pain reduction in this position, after 2 to 5 minutes, try lying over a pillow, as demonstrated here, for a day or two, and then return to lying face down without the pillow. Okay, the second exercise is called prone on elbows. This exercise is used as a progression to the first exercise. If you are having severe pain or acute pain, this exercise should only be performed once lying face down is no longer painful. To perform this exercise, lie face down and bring your elbows under your shoulders. Breathe deeply and allow the muscles in your back and buttocks to relax. Hold this position for a few deep breaths and then return to lying face down. Repeat 5 to 10 times. Again, this exercise always follows lying face down, or exercise 1. The third exercise is called extension and lying. Lie face down and place your hands under your shoulders in a push-up position. Next, straighten your elbows, pushing your torso up as far as pain allows. Keep your buttocks relaxed and allow the back to sag. Remain in this position for a few seconds and then return to the starting position and repeat. Each time, attempt to extend your arms a little more until they are fully extended. Perform 10 reps each session 6 to 8 times a day. Note that sagging your back is important for reduction of your symptoms. You may find maintaining the sag for more than 1 or 2 seconds is helpful if it is reducing and centralizing your pain. The fourth exercise is called extension and standing. Stand with your feet shoulder width apart and your hands on the small of your back. Bend backwards as far as possible while keeping your knees straight. Hold for 2 to 3 seconds and repeat 10 to 15 times. Remember to bend back a little farther each time if possible. Once you no longer have significant low back pain, this exercise will probably become your main go-to in the prevention of future back pain. At this point, it's important that we talk about good sitting posture. It is counterproductive if you do the exercises and then sit for a long period of time in a slouched or flexed position. This will counteract all the good work you just did with the exercises. To ensure less pain and continue improvement, Anna Lee will demonstrate how to correct your posture. The easiest way to achieve and maintain good posture is to use a lumbar support or a rolled up towel. To ensure optimal posture, first roll the towel up. Don't try to bunch it or fold it. And then scoot all the way back in the chair. Good. Until your buttocks is touching the backrest. Then place the towel roll in the small of your back. Sit against the towel, but not over it. Your shoulder blades should not be in contact with the backrest. All right, so to summarize, you want to perform the 4 exercises 6 to 8 times a day. That usually ends up being about every 2 hours. So I know a lot of people like to put a reminder on their phone so that they remember to do them frequently. I can't overstress how important it is to repeat these exercises frequently. You did get into this situation of back pain with repetitive movements that were not favorable for your back, and it's going to take a lot of movements to get you back out of the situation and feeling better. The other thing to remember is if you have acute or severe back pain at the moment, you're going to need to start with exercises 1 and 2. You may be there for a few days with those exercises, and then you'll be able to progress to exercise 3 and 4. Eventually, exercise 3 and 4 are going to be your primary go-to exercises. Okay? We see the best results when people repeat exercise 3 frequently. Now that you know the exercises, you're ready to go. But what do you do to prevent the recurrence of back pain? Well, there's 3 simple things. 1, sit in good posture. 2, perform exercise 3 morning and evening, even after your symptoms disappear. And lastly, remember to perform exercise number 4 after sitting for long periods of time. So this exercise is the one where you bend backwards. Or if you're going to bend forward frequently, you're going to want to do some standing back bends before you do activities like that. So now you have it. Those are the exercises. So if you have mechanical pain and your directional preference is for extension, these exercises should 1, lessen your pain, 2, your symptoms should centralize, and lastly, your movement or your ability to move should improve as well as your function. However, if this does not occur, you're going to want to seek advice from a qualified healthcare provider. All right, good luck.